Most high schoolers spend their afternoons at practice, doing homework, or hanging out with friends. For an active adolescent male, this energetic routine is the baseline of a healthy life. Then comes a standard minor illness. A fever spikes, or a routine viral infection like the common cold sets in. Usually, a few days of rest clears the virus. But in rare cases, the recovery timeline completely derails. The teenager goes to bed to sleep off the sickness and simply does not wake up. Family members try to rouse them, shaking their shoulders or calling their name, but the teenager remains trapped in a deep, unyielding slumber. This severe detachment from normal reality signals to parents that a critical biological event is unfolding. The immediate symptom is overwhelming. The teenager begins sleeping 15 to 20 hours every single day. Media outlets often label this condition Sleeping Beauty syndrome. That nickname implies a peaceful fairy tale rest, but the actual experience is deeply distressing for everyone involved. The clinical diagnosis is Klein-Levin syndrome, or KLS. It is an extreme, episodic hypersomnia disorder. KLS acts as an unpredictable pause button on an adolescent's life. Without warning, school, relationships, and normal development grind to a sudden halt, leaving the patient's support network scrambling for answers. These episodes of extreme hypersomnia do not resolve over a weekend. They stretch out for days and frequently last for weeks at a time. During the brief 4 or 5 hours the patient is awake, they are severely disoriented. They experience profound cognitive slowing, confusion, and an inability to process simple conversations. Their demeanor completely shifts. They display intense apathy toward their favorite hobbies and high irritability, often lashing out at the family members trying to care for them. Extreme involuntary behaviors also emerge. Patients often exhibit hyperphagia, compulsively consuming massive amounts of food. In some cases, they also display hypersexuality. Over the course of a weeks-long episode, the teenager becomes entirely unrecognizable. Their baseline personality is temporarily overwritten by a strange, hostile, and disoriented state. To understand what strips away a person's control over their sleep and behavior simultaneously, we have to look at a specific control center deep inside the brain, the hypothalamus. In this diagram, the hypothalamus acts as the central router, regulating sleep cycles, controlling appetite, and influencing baseline mood. Researchers suspect an inflammatory response from a viral illness strikes the hypothalamus directly, severing these normal communication pathways. A localized malfunction in this specific region maps perfectly to the clinical presentation. The patient loses control over their sleep schedule, their hunger cues, and their behavioral filters all at once, because the single node controlling all three has temporarily short-circuited. Eventually, the episode breaks. The teenager wakes up one morning feeling completely normal, only to realize that an entire month of their life is missing from their memory. This side-by-side comparative sleep architecture chart illustrates the primary hurdle for doctors. On the left, we see the massive, unbroken 18-hour block of sleep that occurs during an active episode. But on the right, between episodes, the patient returns to a standard, healthy 8-hour sleep cycle, leaving zero abnormalities for a doctor to measure. Because the patient sits in the exam room presenting completely normal cognitive and physical health, physicians often misinterpret the medical history. Without active evidence, KLS is frequently misdiagnosed as depression, narcolepsy, or a psychiatric disorder. There is no single blood test or scan that definitively confirms KLS. Clinicians must piece together the diagnosis by tracking the invisible gaps in the patient's timeline across multiple years. Surviving an episode is only half the battle. Once awake, the patient lives with the constant anxiety of a ticking clock, knowing their education, career, and social life could vanish again at any moment. Between episodes, even minor stressors can spark a new cycle. A few nights of sleep deprivation, a stressful exam period, or routine alcohol use can trigger a sudden relapse. Medical management relies mostly on supportive care, with stimulants and mood stabilizers offering highly variable results. However, the condition is self-limiting. For most patients, the episodes gradually decrease in frequency and severity, burning out over a period of 8 to 12 years. Living with Klein-Levin syndrome requires incredible resilience to repeatedly rebuild a life interrupted by missing time. It proves that our continuous sense of self,
our consciousness, and our personality are inextricably tied to our biology.